What is the link between neurological disorders and aging? Have you ever wondered how aging affects our brain health? The connection between neurological disorders and aging is significant. Aging is the most important risk factor for various neurological conditions. These include stroke, Alzheimer's disease, Parkinson's disease, and other neurodegenerative disorders. As we age, our brains experience complex changes that can lead to these conditions. One major aspect of aging is the biological aging of the brain. This can be measured through changes in protein profiles and other markers. Research shows that an extremely aged brain is a strong predictor of future neurological diseases. It is also associated with a higher risk of mortality. On the other hand, a brain that appears biologically youthful is linked to lower risks of neurodegeneration and a longer lifespan. Interestingly, the biological age of the brain can differ from chronological age. This means that some people's brains may age faster or slower than their actual years. Several mechanisms link aging to neurological disorders. First, aging results in the accumulation of damaged proteins and oxidative stress. These factors contribute to the decline of neurons and increase the risk of neurological diseases. Additionally, genetic changes and epigenetic modifications have been connected to age-related disorders, such as Parkinson's disease. Another aspect is the structural changes in the brain. Aging leads to brain atrophy, especially in areas critical for cognition and motor control, like the hippocampus and substantia nigra. These regions are particularly affected in Alzheimer's and Parkinson's diseases. Vascular aging also plays a role. As we age, the blood vessels that supply the brain can become less efficient. This increases the risk of cerebrovascular diseases and strokes, which can worsen neurological decline. In fact, the risk of stroke increases significantly with age due to factors like arterial stiffness and impaired blood flow regulation. A stroke can accelerate brain aging and increase the likelihood of developing neurodegenerative disorders later on. Understanding how the brain ages opens up new possibilities for early detection and prevention of neurological disorders. Emerging tests that assess the biological age of the brain could lead to personalized interventions before symptoms appear. This proactive approach aims to maintain brain health rather than just treating issues after they arise. In conclusion, the link between neurological disorders and aging is clear. The progressive biological aging of the brain and nervous system explains why advancing age is the strongest risk factor for many neurological diseases. Ongoing research into brain aging promises to improve prevention, diagnosis, and treatment tailored to individual needs. Always consult healthcare professionals for personalized advice regarding brain health.